because of medical illness or death, are insured at the time of the precipitating illness.
Wow.
And for people in general, the average out-of-pocket expenses is between $10 and $11,000 $10 and $11,000 out of pocket that they've spent. For people who have a diagnosis of cancer, their out-of-pocket expenses with their insurance averages about $30,000-$35,000 before they declare bankruptcy.
So we have, from a public health perspective, we could say we have an epidemic of medical bankruptcies.
Oh, absolutely.
Yeah.
And
I have a question here from a listener. A listener wanted to know, how does the Canadian system, in talking about foreign national health care plans, how does I'm reading the question verbatim here, a listener asked, from an economic point of view, what's wrong with the Canadian system versus system of health as opposed to France, et cetera?
Well, one of the problems the Canadian system has is it's underfunded.
Okay.
But the other thing is that the Canadians, when they went to a single-payer form of health care, they were primarily solo practice, independent, didn't have a lot of large multi-specialty groups, the way in which health care is most commonly delivered in the United States today. So that's a challenge for them. If you look at, we spend over $7,000 per person on health care in the United States. So we have a lot of technology readily available. And it's not as unusual in Canada to have a large community and not have an MRI close at hand, or so sometimes they have to travel great distances. Now, I've seen them do some very creative things to try to get around that, but it's a challenge for them.
I see. I've got a question, and it's an operational one. The devil's in the details. If you were appointed the next Secretary of Health and Human Services, and I don't see any reason why you shouldn't be, by the way.
Right.
And you probably know the Obamas. You're all from Chicago. What I heard last night at the convention was a lot of gift wrapping of air, not enough substance. National health care, fine.
But no, he does have he does have a well-defined plan.
Well,
I think it's available on their website that they talk about it, because I had a debate earlier this week with one of his policy people here in Denver regarding the plan.
All right, tell our listeners how the plan how the plan would be executed. How do we get from A to B? Well,
the plan is not dissimilar from Massachusetts, but they don't require mandates. What they want is to expand public subsidies for people who cannot afford health insurance, to give them access to and improve have some standardization in terms of the benefits that are made available. If you were going to say that more people should have access to Medicaid, in many states, I can really only speak most about Illinois, is, you have to be over 200% below the poverty level to qualify for Medicaid. And so they're talking about shifting that, so allowing more people to be eligible, and then having some standardization in terms of benefits that are available to folks. And then providing subsidies for people to be able to buy into plans, such as the plan that federal employees have available to them. And at the same time, requiring the insurance company to eliminate some of the practices that cause people so much problems, such as discrimination for pre-existing illnesses and dropping people once they require large amounts of benefits.
Going back to the platform itself, and I'm going to ask my two co-hosts here, just for a little forbearance, I'm going to ask two questions. Our next guest is going to be Gwendolyn Mink. Do you know her at all, Dr. Fagan? Gwendolyn Mink? She's a professor of government at Smith College, and she's the author of Poverty in the United States, an encyclopedia of history, politics, and poverty. She's the author of the upcoming Feminism and Inequality, and she has one of my favorite blogs, Feminist Social Justice at blogspot.com. She's going to be our guest 2 weeks from today. And she, in her blog, she was picking apart the Democratic Party platform. She had two issues, and let me just read one, and then I'm going to ask your comment on them, because you mentioned the same quality of health care that government employees have, and actually she picked up on that in her blog. In her blog, she says the 2004 Democratic Party platform declared health care as a right, not a privilege. That platform contained a different emphasis, but not a different impulse. In 2004, the party was concerned with costs and affordability, the expansion of SCHIP, prescription price negotiation for seniors, and pushing scientific boundaries to fight disease. Concerns also espoused this year. Two commitments articulated in 2004 that were not repeated this year were, one, to provide all Americans with access to the same coverage that the members of Congress give themselves, and two, a patient bill of rights. How come those two things were deleted since 2004?
Listen, I'm not the one to defend the Democratic platform, just as I pointed out.
Well, you're going to be the next Secretary of Health and Human Services.
I was debating against, much to their consternation, with
right on.
Obama's domestic policy analyst, because I have problems with it.
Good. Good. That's what we wanted to hear.
I was unhappy. I'm unhappy with the Democratic platform, and that we punt on this issue